So I'll go ahead and call this meeting to order. This is the Concord Board of Health meeting and public hearing. Today is Tuesday, October 15th, 2024. And we are now present with a quorum with hybrid meeting attendance present in person and on Zoom. I'm Randy Kring. I'm the chair of the Concord Board of Health, and I welcome you all to this meeting. We'll go through with our agenda here. So we'll start by approving minutes from our last meeting on September 23rd, 2024. The meeting minutes were sent out to the board in advance of the meeting. And I would ask if any members of the board have any edits to those minutes. And if not, I would entertain a motion to approve the minutes as written.
I move to approve the minutes.
Okay, excellent. And I have a second.
I second it.
Great, excellent. So all in favor, and since we are hybrid here, we'll go ahead and do a roll call vote. So starting with present.
I move approve the
Okay,
minutes.
so Dottie moves to approve or approves. Randy Kring, I approve. We'll go ahead, Jim, with your vote.
I approve.
Great, and Kurt.
I approve as well.
Excellent. All right. So with that, the minutes have passed and are approved. All right, so we'll move on to the first or the next topic of discussion, which is the nicotine-free generation regulation. Why don't we start by having Melanie give an overview of what that involves, and then we will have a discussion amongst the board members, and then proceed to a public comment period on the updated regulation.
All right. Nicotine-free generation applies to tobacco products containing nicotine. Focuses on prevention for the next generation. It does not prohibit any existing customers as of today. It is just prohibiting sales as of a certain date as they age in. It will prohibit those from being able to buy tobacco. This allows retailers to adjust their market. And hopes to that we can reduce the use of youth having access and gaining, becoming addicted to nicotine.
Excellent. So compared to the current regulation, currently anyone over the age of 21 can purchase tobacco or nicotine products.
Any nicotine product, and this regulation will make as it's written right now, as of January 1st, anyone born on or after January 1st, 2004 would be prohibited from buying nicotine products
In the town.
in the town of Concord.
And so that 21, anyone who turns 21 before that date would be allowed to purchase nicotine products. Anyone who turns 21 after that date would not be allowed to purchase nicotine products in the town.
Correct.
Excellent. Okay. So I'll start by opening the discussion to the board members. There were several letters sent out by Melanie in advance of the meeting, both in favor of and opposed to the updated regulation. Assuming that the board had the opportunity to review those letters. Specifically, we received 3 letters in support of the updated regulation. One from Christine Schuster, who is president and CEO of Emerson Health here in Concord. Another from Kelly Kalo, who's the director of public and community health in Hudson. And a third from Maureen Busby, who is the regional tobacco prevention program manager in Melrose. We received 2 letters in opposition to the updated regulation. One from Ryan Kearney, who is with who's general counsel for the Retailers Association of Massachusetts, and a second from Kyle Fellman, who is a representative of the National Convenience Distributors. So those letters were available for the board to review. And I'll go ahead and open up for any discussion if there's any points from those letters or any other thoughts from the board that would like to be discussed before we open to public comment.
I heartily support this regulation. The effects of tobacco claim the lives of almost 500,000 Americans a year. And I think this is a move in the right direction. If it's just virtue signaling, I think that virtue signaling can sometimes be actually virtuous. And I, again, hardly support this.
Excellent. Any other comments?
Yeah.
Board members
I
present?
view, I view it as a reasonable step in the right direction to move away from the use of nicotine over time. You know, I'm not big on bans or prohibitions, but I think this doesn't overreach and it's pretty focused in its intent just to focus on the next generation. So I support it as written.
Excellent. And I would point out, so just as a sense of what our community is doing, so the towns of Malden, Melrose, Reading, Stoneham, Wakefield, and Winchester have all approved in their towns similar regulation for a nicotine-free generation. So we are not the first in the Commonwealth to be discussing this. And Brookline was the first town in 2020 that passed legislation similar to this. And importantly, you know, this is not about criminalizing the act of smoking. It's and not about possession of nicotine products. It's about sales and purchase with the intent, in my view, of making this harder for young people to access. And that barrier of convenience can go a long way in prevention. If there are no other comments from the board, then I will go ahead and open the discussion to the public. And we'll proceed with asking each person who wishes to comment to limit your time to 3 minutes. I'll set a timer so that we can move through and have everyone have a say. So why don't we start in person? Is there anyone present in person who would like to comment? We'll start over here.
My name is Stephen Helfer, and I represent Cambridge Citizens for Smokers' Rights. We receive no industry or government support whatsoever. On an historical note, I'd like to say the American colonists depended on the tobacco trade to pay for our War of Independence. It is really ironic that in Concord, where the shot heard round the world, is now considering what would become within a relatively short period of time, a total prohibition of tobacco and nicotine products. The CDC reports that teen vaping has reached a 10-year low and that teen smoking is at an historic low, less than 2%. According to Gallup, adult smoking is at an 80-year low. There is no need to impose onerous new restrictions on retailers who sell these products. Many of these stores are owned by immigrants of color. They put in long hours and depend on very small profit margins. I like to call it a generational tobacco ban, would significantly damage their businesses. Tobacco control is out of control, and there is a profound power disparity here regarding the generational tobacco ban. Most, if not all of its proponents, are professional activists who receive grants from powerful tax-exempt entities or state government. Minority business owners and private citizens receive no such funding and are far less experienced speaking to policymakers. It is by no means a level playing field. A generational tobacco ban is coercive, discriminatory, and unnecessary. Please do not impose it on the town of Concord and its store owners. Thank you.
Thank you for your comments. Anyone else? Yes, go ahead.
My name is Drew Patel. I'm a tobacco retailer here in Concord, Massachusetts. Owners of Concord Exxon in the past 15-20 years. Let me first by asking you guys, what good is this tobacco control going to do? Nicotine-free generation. How hard is it to go to the next town over or even up to New Hampshire to buy wholesale products for cigarettes, vaping? The more you try to ban, the more it's going to provoke others to take a step forward and go to the next town or the next state over, which is not that far down, and basically buy things at a bulk value. The more they buy at a cheaper value, the more they can store in their homes. The more they have in front of them, the more they're going to smoke. The more you try to control it, you're trying to make matters more worse. Not to mention, how many active tobacco retailers in Concord actually have a decent value in terms of tobacco profit? You say you have 14 retailers in Concord, right, for tobacco? What good are they? 14 is nothing. Out of those 14, how many actually do good business in terms of tobacco? Not many. Not to mention convenience store business, smoke shops. We're all penny businesses. There's a reason why we stay open 17, 18 hours a day. There's no reason to basically provoke a ban on the future generation. And if you're trying to control tobacco, how about we talk about liquor? That's also age-restricted product. And that also affects the internal immune system as well. Your blood, adrenaline, everything. How about you guys all take a look at that too and start banning each and everything instead of just focus on tobacco? The more you're trying to control, you're provoking more to others to smoke even more because you're going to buy even more the next store over, the next town over, and bring it back to their homes in Concord. So what I'm trying to say is you're not trying to control it. You're actually enhancing individuals to take a step further and buy more. Because the thing is, I'm not going to go to the next town over twice a day to get my tobacco products. I'd rather buy multiple and come back home and smoke it. But here's the thing, if you have more tobacco products in front of you, you're more likely to smoke it even more. Is that clear?
Thank you. The next, yes, go ahead.
Hi, I'm Mark Gottlieb, Lumen Street in Cambridge. I'm the Executive Director of the Public Health Advocacy Institute at Northeastern University School of Law in Boston. And we represented the town of Brookline pro bono in successfully defending this policy from a legal challenge from the retail sector of the tobacco industry. And as you know, the case went to the Supreme Judicial Court and established nicotine-free generation as a valid exercise of local health, public health powers. And we offered our help to Brookline and any other town adopting this policy in Massachusetts because we believe it creates healthier communities by very gradually ending the sale of tobacco products. And it does it, as you know, without affecting a single existing retail customer who can be sold tobacco products today. And if widely adopted, it will make a huge difference. Someday, like smoke-free workplaces, Tobacco 21 bans on tobacco sales in pharmacies and the flavor ban, it may in fact become a statewide law. And I want to mention that in the current issue of the journal Lancet Public Health, there's a study that estimates the impact of a generational tobacco sales ban on lung cancer in 185 countries. And it finds that based on current trends, the policy would prevent nearly 2 million lung cancer deaths just among those who were born between 2006 and 2010. I have a copy I'm happy to share tonight. So while the tobacco-free and nicotine-free generation is designed to eventually end all tobacco product sales in jurisdictions that adopt it, I think it will also have some positive near to midterm effects that build on what we learned in Tobacco 21. Older peers with access to tobacco products are a significant source of these products for youth. And it's expected that such access will be reduced with the progressive increase of the minimum sales age under this policy. Because while a 21-year-old may still be an older peer to a sibling or a high school student, it becomes less likely that someone in their mid to late 20s, after this policy has been in effect for a few years, would still be in a teen's social circle. Likewise, peers who model the use of tobacco products have long been a predictor of youth initiation, and with fewer older peers modeling tobacco product use as a result of this policy, it can be expected to contribute to a reduction in tobacco initiation by middle and high school students. 57% of Americans in a national survey conducted by the CDC in 2023 actually favored a policy to ban the sale of all tobacco products. And quickly, I want to address concerns around contributing to black markets with this policy. There must already be strong demand for a product to create a black market. Consider the 2020 flavor ban that resulted in out-of-state purchases and a significant, or at least a non-trivial black market. Here, we don't have a existing demand with those in the next generation. And without that demand, there shouldn't be a black market. So I think those concerns may be unfounded. Thank you.
Thank you very much.
couple of articles.
sure.
Dr. Pring, you have 3 people in the four, maybe hands in the waiting room.
Okay.
So you know.
We'll finish with the members, present, public, or present in person first, and then we'll go to the,
Okay.
waiting room. Yes. Anyone
Hi.
next? Yes.
I'm Maureen Busby, and actually a meeting I was supposed to be at was changed. So you do have some written testimony from me, but I did just want to take this opportunity to add a couple more notes. I was at a Board of Health, and by the way, I'm the Tobacco Prevention Program Coordinator for the 6 communities in addition to Brookline that adopted nicotine-free generation earlier this year. I was at a board meeting earlier this year when a board member put his own feelings aside and said, quote, "We do it for the kids." And that in the end is what this is all about. We know that adolescent brain doesn't fully develop until about age 25. The industry knows this. That's why they work so hard to develop new products that attract young people. Jewels that look like flash drives, vape pens that look like highlighters. If the only reason you vape, I don't mean you, but anybody vapes is to cut back on smoking, do they really need a vape device on which they can play a video game? I haven't actually seen one yet, but whenever I hear about something new, and I've heard about these, I see it soon in local stores. I have seen vape devices that have an LED screen that indicates how many puffs you have left. I suspect that triggers the user to buy another vape, just as I stop to get gas when I notice the gas indicator on my car dash. The industry knows how to attract young people. They know how to addict young people. That playbook hasn't changed. My colleagues and I can't keep up. Product development gets faster and faster. It never ends, and it won't ever end. And that's why a step that separates our youth from tobacco's latest inventions is so important. Thank you.
Thank you.
My name is Dr. Deborah Green, and I live at 341 Madison Drive in Concord. I served on Concord's Board of Health for 6 years, and my one regret is that our efforts to prevent youth tobacco use were thwarted by the COVID-19 pandemic. So I'm relieved to see the current Board of Health take up this important public health issue, and I'm in full support of your proposed regulation. I'm a board certified practicing emergency physician in the town of Concord. I'm familiar with the effects of tobacco and secondhand smoke on patients of all ages, caring for patients who are at the end of their life or simply struggling to breathe due to tobacco-related diseases and cancers, and unfortunately a sad part of my daily work. But even more saddening and maddening is that despite decades and decades of education and prevention efforts in schools and communities, I still see teenagers and young adults using tobacco and nicotine products. In 1995, 35% of high school students used tobacco products. 20 years of very intense tobacco reduction efforts reduced that number to 6% in 2017. Last month, the Centers for Disease Control released the results of their National Youth Tobacco Survey. 1 in 8, or 12% of high school students are using tobacco and nicotine products. Even more alarming, 1 in 15 middle school students. It is clear that we need to do more. So as much as we educate our children, know that they are bombarded by advertisements and promotions and social media from the tobacco industry. It is this normalization of tobacco use that we must fight. Given everything that our kids can get into with their teenage risk-taking behavior and peer pressures that they face, certainly nicotine and tobacco products must seem like the lesser of all evils. But as Ms. Busby said, we know that adolescents and young adults are particularly vulnerable to the effects of nicotine. We have decades and decades of research showing this. We have studies after studies that have been repeated and validated. None of this information is new. What is new and what is always changing and evolving is the latest developments from the tobacco industry. Their push to entice our children to use their products. As Ms. Busby said, they spend billions of dollars in development and marketing of new products. Again, look what happened with the epidemic of vaping we saw. There was no FDA regulation and these products spread like wildfire throughout our schools. Now look at the nicotine pouches. These are cheap, very easy to conceal, and even more potent than a pack of cigarettes. So it is not enough for us to ban menthol or flavors or specific products or devices. The tobacco industry will always develop a new product and they will always find a workaround. This proposed Board of Health regulation is the only way that we can ensure a tobacco-free generation. Thank you.
Thank you. Anyone else present in person who wishes to speak? Sure, go ahead.
Thank you to the Concord Board of Health for your leadership in holding this hearing today. My name is Anthony. I am the Health Director for Melrose, Wakefield, and Stoneham. The responsibility you bear in protecting public health is immense, and your willingness to consider these policies speaks to your commitment to the health and safety of this community. What if I told you that there is a substance that claims the lives of 480,000 Americans every year? What if I told you that only 1 in 10 people who try to quit this substance will succeed? And what if I told you that the industry behind this product spends over $8 billion annually in advertising, targeting young people to secure future generations of users? The spoiler alert is this is tobacco. As members of the Board of Health, you would feel compelled to take action to protect our families, our communities, and most importantly, our youth. Over the years, Massachusetts towns and cities have pioneered groundbreaking tobacco policies that have dramatically reduced smoking rates and saved lives. For instance, the smoke-free workplace laws, which started at the local level, were revolutionary. It wasn't long ago that smoking in restaurants, bars, and even offices was commonplace. But the courage of local health boards to adopt smoke-free workplace regulations laid the foundation for the statewide ban that followed. Today, it's hard to imagine a time when people smoked freely indoor public spaces. Local boards also led the charge in enacting the smoke-free housing policies that protected thousands from the dangers of secondhand smoke in multi-unit residences. And let's not forget the pharmacy tobacco sale bans that began in Boston in 2008 and spread across the state. What began as a local initiative became a statewide movement, sending a clear message that places of health and healing should not sell products that cause illness and death. In 2020, the flavor ban took the next step. Recognizing the tobacco industry's targeted efforts to lure young people with candy-flavored products, local boards acted swiftly. Massachusetts was the first state to restrict flavored tobacco, a regulation that once began at the local level. And the success of the statewide Tobacco 21 law, which raised the legal purchasing age to 21, is also owed to the leadership of local health boards. The evidence is clear. The policies enacted by local health boards in Massachusetts have been instrumental in reducing smoking rates and preventing tobacco-related deaths. Considering the broader context, smoking remains the leading cause of preventable death in the United States, surpassing the fatalities from alcohol, car accidents, drug overdoses, and even gun violence combined. Despite decades of progress in tobacco control, millions of people remain affected by nicotine addiction. The numbers are staggering. 68% of adult smokers want to quit, and 55% of them attempt to do so every year, but only 10% succeed. These statistics tell us the truth.
You can finish yours.
Okay.
Yeah.
Nicotine addiction is incredibly difficult to break. This is not a matter of personal choice. It is a compulsion driven by a highly addictive substance, and the tobacco industry is banking on it. Let's not allow another generation to fall victim to an industry that profits from addiction and death. Let's create a future where the youth of today grow up without the temptation of nicotine and without the lifelong struggle of trying to quit. This policy is our chance to make that vision a reality. Thank you.
Thank you. Anyone else present? Yes.
Hi, I'm Jill Blau, 50 Everett Street. So I don't have prepared written comments. I think we're all really familiar with the hazards and risks of tobacco use, and I think we're all in favor of reducing deaths that come from that, including the business owners. And I know, speaking as a former small business owner, I am sympathetic to the store owners that are here and their concerns, but I also remember after being on the Board of Health for 7 years here, that there were similar concerns when we banned the sale of individual water bottles and went through the other tobacco restrictions where there was the business owners were the ones that were speaking up saying, you're putting us at risk, you're just driving the business elsewhere. But the reality is I didn't see any businesses close based on those other restrictions we put in place. Those businesses all still exist, those customers will still exist. Yeah, if I'm smoking or I want a bottle of water, yeah, I'm gonna pick it up in another town, but that doesn't mean I'm running back and forth all day long and these businesses are going out of business. So yes, I'm sympathetic. I know you guys work really hard, but there's other healthier products that could be sold that probably have different profit margins. And, it's just, the risks are way too great to prioritize the bottom line on this one.
Thank you. Yes, go ahead.
My name's Anthony Aishat. I am a resident of the town of Brookline. I was a co-petitioner on this policy back in Brooklyn in 2020, actually. I also usually don't disclose who I work for, but I do think it's actually relevant for this discussion, just because someone did point out that there might be funding. I am a full-time pharmacist paid by Mass General Hospital. I am speaking for my own during this time period. They have nothing to do with this. And the reason I don't bring them up is because I'm sure we're all aware they need less media attention. So my primary interest in bringing this policy up with my colleague who will be speaking soon is that as someone who works in primary care doing disease state management, there are a lot of things that we can do within the healthcare clinic and system to help people. There are things that we have to rely on society itself and public health, providing safe areas for walking, providing school, healthy, nutritious food, and keeping toxic substances away from people who shouldn't have it and who don't have the decision-making abilities to make that decision for themselves. I'm not going to mention the health-related aspects of tobacco smoking. I think everyone is aware of it. Part of the reason I also brought this up is I am a son of an immigrant who came to this country and initially was working in a gas station overnight, was addicted to tobacco, and it took multiple heart attacks and surgeries for him to finally give it up. It's an incredibly difficult thing to give up, more difficult than heroin, more difficult than alcohol, despite what others may think. Alcohol and marijuana are often compared to as other comparators to this. Tobacco has no redeeming value, zero. Alcohol, you can make the argument, people can use it for cooking. There's still debate about minimum alcohol and how effective it is for other things. Marijuana, there is evidence in the right population that it can help with certain things. Tobacco has no benefit at all. A recent article I read, quote, Weinstein states that smoking cannot be interpreted as a choice made in the presence of full information about the potential harm. Their studies find that smokers underestimate their personal risk and often misperceive the nature and severity of tobacco-related diseases. Smokers often do not think carefully about risks from smoking when they first begin to smoke. Youth tend to initiate smoking based on the notion that it is a fun and exciting behavior. They often learn of the health risks from exposure after initiation through exposure to anti-smoking media messages about the hazards of smoking. Youth often repudiate their earlier decision of smoking, feel guilty for having ever started smoking. 75% of tobacco users regret it before their age of 30 or 40 years old. You will notice most of the speakers who speak against it are not current users. The cost
That's fine. Yeah.
Sorry. Cost of Clarkport is negligible since all taxes and funds from tobacco sales go to the state and not to the town. But the cost to every household in Massachusetts is $1,118 on average. It's notable that in Brookline, after nearly 5 years of this policy, no retailer has shut. All 17 with a tobacco license are still open for a town of 63,000 people. In Concord, there's 14 retailers for 18,000 people, roughly twice the ratio of retailers for this population as compared to Brookline. I would close to ask that you think about who cannot speak at this. And those are the people that are likely to be impacted that are at home right now, either being read bedtime stories or studying for school. Those are the people that this is meant to impact, and that's children. Children should spend their time being curious about healthier and cheerful things, not about toxic substances that will make them sick with the intent of just getting them sick and addicted. I ask that you vote in favor of the vulnerable and against billion-dollar tobacco companies, which are ultimately who fund people who are speaking against it. Thank you.
Thank you. All right, so we'll go on to Zoom. Let's see, why don't we start just from my view, I can see upper left, Moira.
My name is Maura Carter, and I work as the public health nurse for the towns of Concord and Maynard. I'd like to speak in support of the nicotine-free generation regulation. As a nurse and as part of the public health workforce, I'm invested in the health of the community. Prevention is a key aspect of individual and community health. Disease prevention, injury prevention, and substance use prevention, for example. By decreasing access to a harmful substance, I see the nicotine-free generation regulation as an important population-based intervention toward primary foundational prevention, allowing for a healthier community for generations to come. Thank you.
Thank you. We'll go on to Ginny.
Hi, my name is Ginny Chadwick, and I'm a registered voter of the state of Missouri. But I was an elected official in Columbia, Missouri, and I was actually one of the bill sponsors for the first Tobacco 21 policy. And I was able to do that because the lead of Massachusetts Board of Health. I have to say that I now sit in Somerville, Massachusetts. I'm a PhD student at Brandeis University. As many know, PhD students are not well funded on government grants. But you know, I speak to you wanting to share that the actions that you make are not just virtue signaling, or they are really, and they lead to actions at the state level, but they lead to actions across the country. I was able to sponsor the first Tobacco 21 bill. I think it was the 31st to pass because of local boards of health in Massachusetts passing policies just like these. So I want to say thank you to each of these Board of Health members that are here considering this tonight. I was able to testify across the country helping Tobacco 21 pass, and I heard many convenience store associations, retail associations, and people who profit from the sale of tobacco products speaking at these meetings, saying that by passing Tobacco 21, we would put onerous regulations on retailers that were damaging their profit margin, that were creating discriminatory actions. And what we know now is that Tobacco 21 was reducing youth use rates. And we know that the industry specifically targets our marginalized populations with their product, and it creates more harm. So I guess I ask you to do some peer modeling and support this nicotine-free generation policy, knowing that not only will it benefit the youth here in Concord and in Massachusetts, but it'll benefit people around the country by your leadership. And another argument that we often hear was they're just going to go to the next community. We know that that wasn't true with Tobacco 21, and it's not going to be true with this also. This will reduce youth use overall and long-term reduce the harms of tobacco. So thank you so much for letting me speak. Thank you for considering this. And I look forward to hearing the rest of testimony and your leadership here.
Thank you very much. All right, we'll go on to Kate.
Hi, thank you. My name is Kate Silva. I'm a professor of law at Boston University, and with Anthony Ishak, I led the effort to pass this similar idea in Brookline. And of course, I'm not funded by anybody. I'm just interested in adolescents. I wanted to say a couple of things that might come up for you guys as you think about this idea. One is often people struggle with a comparison to cannabis and alcohol. And I know because you're health professionals that you know that tobacco is in a completely different league, and both in the sense of how much harm it causes and also in the sense of its level of addictiveness. And it's so addictive that the vast majority of users who are adults wish they were not using and would like to quit and find it too difficult. But they begin when they're adolescents. Virtually everyone begins when they're an adolescent. And so a generational ban can have an effect much more quickly than decades from now because it pushes out the social networks. So I just want to speak quickly to the generational design and what's so special about it. There is a thorny problem addressing such an addictive substance because there are many people who currently use who feel the need to continue using. And this generational fire break says if you need it, if you're currently using it, we would like to support you in cessation, but this isn't going to touch your use of it. In the same way, it reduces risks of black market tremendously because you don't have an up and coming group who are using it, and those who need it continue to be able to access it legally, so there should be no black market. Similarly, retailers don't lose a single customer that they have today, not one. Unlike flavor bans, which pulled a product off the shelf immediately, you couldn't have a more gradual transition out of selling this deadly product. It's just the inability to bring new customers in. And in fact, in Brookline, not one retailer has closed, not one. The ban has been in place, or this generational fire break has been in place for since 2001. I also want to speak to the fact that this particular design avoids an open question right now about whether vaping is harm reduction from combustibles. Possibly, if you're using combustibles, you should switch to vapes, but that debate, if it exists, is not implicated here, because the people affected by this generational fire break are not using combustibles either. So this is a don't use anything, do not become dependent on nicotine idea. Finally, I just wanted to say that it does have a local impact. We've seen it with Tobacco 21. There's plenty of research that suggests that the distance you have to travel for nicotine products does reduce nicotine use. So this will have an impact in Concord. Obviously, we are concerned about whether or not we can get it to have a broader impact. And I would really encourage you to stick with that January 1st, 2000 birth date, regardless of what your implementation date is, because that will keep Concord, or put Concord in accord with the 6 other jurisdictions who have recently implemented this regulation. Brookline has an earlier date because we were several years earlier, but everybody else has this 1/1/2004, and I would encourage you to stick with it. Thank you so much for considering it, and I really appreciate it. And you're doing incredibly important work for the future generation. Thank you.
Thank you. We'll go on to Alex.
Yeah, I just have 2 quick points. I'm Alex Weatherall. I'm the president of the New England Convenience Store and Energy Marketers Association. So in my role, I'm here to support convenience retailers. No guess as to where I stand on this issue. I'll just make 2 points. One, the pharmacist from Mass General Hospital went on at length about combustible tobacco. I just want to remind the board, this isn't about combustible tobacco. It's about nicotine. Now, if you model what you intend to do against Brookline and Maureen Busby's other towns, you're gonna disallow my retailers from selling nicotine to anyone who, well, you know the rest of the story. It's not just combustible tobacco, it's all these products. So it's going to make it hard for a grandfather in times to come to celebrate the birth of a grandchild with a cigar, because you'll have banned that privilege. So decide what you want about that, but it's just a point that I want to make. It's not strictly combustible tobacco, it's nicotine bearing products, period. And the other point is, and I'll go back to Maureen, it's all about the kids. The illogic is just confounding to me. If it's all about the kids, then why are you intending to put in place a law that's directed specifically at adults? You're creating 2 classes of citizen. It's un-American and it's illogical. That's all I have, but thanks for giving me the opportunity.
Thank you. We'll go ahead with Emily.
Hi, my name's Emily Ouija. I live at 231 Brookline Street in Cambridge. I'm speaking in opposition to this generational tobacco ban. I'm a concerned private citizen. I have no affiliation. I'm speaking today because I really resent the fact that professional tobacco control activists are going around the state, town by town, pushing for this proposal to restrict the freedom of adults to choose for themselves. The legal age to buy tobacco and nicotine in Massachusetts is already 21. This proposal means you'll be prohibiting adult choice. A ban on the next generation of adults is still a ban. In Massachusetts, we don't believe it's the place of public health to ban alcohol, marijuana, unhealthy food, and gambling. I've seen firsthand the incredible harm that alcohol, marijuana and gambling can cause in people's lives from people in my family and friends. And yet these are all still choices we've seen fit to allow adult consumers to make for themselves. And I agree that they should be choices, even though I've seen them cause harm. If we place a ban on the ability to purchase tobacco and nicotine, we're saying it's okay to dictate adult lifestyle choices, and there will be no end to it. I ask you to please not consider this proposal and stand up against special interest activists who don't represent Massachusetts citizens. According to the Town of Concord tourism website, Concord was the birthplace of American independence. Thank you.
Thank you. And finally, I believe we have Scott.
Three more.
Oh, three, okay,
Yeah.
okay. Sorry, just to my view. Next is Scott. Thank you.
Thank you, everybody. My name is Scott Francis. I work for MORE, Massachusetts Organization for Addiction Recovery. And I'm asking you to please consider this nicotine free generation work because you know, it was asked earlier, why are we advocating against nicotine when we could be advocating against alcohol? Well, I can tell you as a person who was in recovery from alcohol use and nicotine was way harder to quit. It was wrapped up in all kinds of habit loops. And, I had 2 returns to use from alcohol. It lasted 4 times I drank. I had 2 returns to use from nicotine and it lasted years. And it cost thousands and thousands of dollars. And it really had a negative impact on my health and my wellness. So I'm asking people to really think about this because it's part of the science of change to keep good things close and bad things far. So this is something that if we can keep out of the hands of younger adults, it makes it harder for even younger people to take their first use of tobacco. So I'd like to turn it over to my wife.
Hi, just really quickly, my name is Maria. I grew up in Brookline and I actually had my first, I started smoking when I was 14. Got my cigarettes at a convenience store along with my friends. I can't remember the exact details, but I just think it's really interesting that I did start smoking then. I smoked for a long time until I actually lost my housing, surprisingly, because I was so addicted to nicotine that it was really hard for me to not drink and really just take care of myself and follow the rules of my housing. So I just wanted to share my experience. Thank you.
Thank you.
Thank you both. All right, and
So I have
yeah,
a Michael Cho and a Peter Brennan on my
Okay.
screen.
why don't we start with Michael?
Hi, thanks for having this meeting. My name is Michael Chow. I'm a lecturer in genetics at Harvard Medical School. And as people may or may not know, cancer is actually a disease of genetics. So I have been following this personally, though, not in a professional capacity, for a number of years. And I just want to make a couple of quick observations. One is that this is not a ban on people using tobacco over a certain age. It's not a violation of their civil rights or abilities. It's actually a restriction on sale, not use. So that's one important thing. We ban sale of things like lead paint and asbestos all the time when we realize there's a public health benefit to doing so. And the other thing I would like to say is that this is extremely gradual, as other people have said, and in so doing, what it's really preventing is sales to people who are new smokers. I think that's got to be clear to everybody at this point. So only new smokers. So essentially, when the retailers, and I have sympathy for the retailers because I was also an entrepreneur a lot of my life, when the retailers are saying they'll lose revenue from this, they're basically saying that what they want is the revenue from people who are newly addicted to tobacco. And I just think that it's important to point that out, that this does not talk about stopping people from buying cigarettes who are of legal age, who are already smoking cigarettes, and we want to help them stop smoking. But it is a ban of sale and new revenue from newly addicted people, or preventing that. So I just think it's to say that you want to participate in the revenue or you're afraid of loss of revenue, it is only from newly addicted people. Thank you.
Thank you very much. And then
I have a Peter.
Peter. Go ahead, Peter.
Good evening. My name is Peter Brennan. I'm the Executive Director of the New England Convenience Store and Energy Marketers Association. We represent the 7,000 convenience stores throughout New England, including 3,000 in the Commonwealth of Massachusetts and roughly a dozen in Concord. We oppose this policy. We oppose this policy for a number of reasons. We believe that adults over the age of 21 should be able to make choices about what they put into their bodies, the products they consume. And you know what? The information's out there. Some things are good for you. Some things are bad. Some things are best in moderation. There's a lot of products over the age of 21 you can't purchase. Nicotine is one. Our retailers are the ones that keep these products out of the hands of the youth. So we get a little offended when you dress up a policy that's designed to harm retailers and you say that it's because of the kids, because you need to show an ID at our stores. I don't think that's the case at every store, and it's certainly not the case on the black market. So we oppose the policy on that ground. We also oppose the policy because it's not just the nicotine sales that you lose as a retailer. What you also lose is the entire basket of goods. If you're a nicotine user, you want to make a nicotine purchase because you're over 21 as part of your errands, then you're going to go to another town now because you want to do that at the same time that you get gas, at the same time that you get milk, at the same time you get eggs, bread, lottery products, anything else that you might buy at our stores. So it is enormously harmful, and it really feels like a slap in the face to our retailers that are essential businesses, that are valued members of the community, that sponsor the Little League teams, that attend meetings like this, to just say that, well, we would like to virtue signal that this is a bad product. So we were going to put you at a competitive disadvantage against any neighboring town, or in a bigger policy, any neighboring state. And while many have cited that no Brookline retailers have gone out of business, I mean, have they reduced hours? Do they have the same amount of staff? Do they have the same, stock? Because I would say that they probably don't. Because if you can go right next door, you will. So this is harmful. And since, based on the conversation between the board members prior to the public hearing, it sounds as though you're traveling down the path of adopting this policy. If you plan to adopt this policy, I would ask that you at least do a study. Does this impact youth tobacco nicotine usage rates? Does this impact public health? Does this impact your retailers? Does this impact the amount of tax that the town receives from those retailers? Because you should really study something before you implement a very serious policy. And I realize that the way it's drafted, sure, certain things won't be known until a few years out, but you could probably model that. So I think that if the board was going to adopt it, maybe you would like to study it first. Peter Brennan, I'm free to take questions, or you have my contact information. I did submit a letter of testimony, but I believe it was back in August, so I can resend. Thank you.
Thank you. All right, are there any other people on Zoom wishing to make a comment?
I don't see any.
Okay, excellent. Well, with that completed, I'd like to thank everyone present in person and on Zoom for commenting during the public hearing portion of this meeting. I would now open up to the board for discussion regarding what was discussed. If there are, certainly that was a lot of information to undertake. We've, of course, this is, I think, probably our third or fourth meeting as a board discussing this. So just for all those present to be aware that this is not, of course, the first time that we have brought up this change in the regulation. And so just wanted to make the public aware that the board is quite well versed already in this. And again, very much appreciate the public comment. What I would ask at this point, hearing no kind of further discussion points from the board, would be a straw poll of the board members in regards to when we should hold a vote on this, on adopting this regulation or rejecting it. So straw poll, non-binding, but just are the board members interested in holding a vote tonight, or would the board members like additional time to consider what was discussed tonight and delay the vote until next month? So I'll start with Dottie. If you
I feel comfortable voting this evening.
Okay, excellent. Jim?
Yes, I think we should vote this evening.
Okay, and Kurt?
I'm comfortable.
Great. And Portia, welcome. Sorry, I didn't realize you had joined.
No,
Thank you
no
for being here.
problem. Yeah, I think I'm comfortable voting tonight.
Okay, wonderful, excellent. And I am as well. So with that, said, why don't we go ahead and proceed with the vote on the nicotine-free generation regulation? Oh, I would, yes, I would entertain a motion to, thank you, to vote.
Yeah, I move to vote on the nicotine-free regulation.
Okay, and I'll, take a second.
I second the vote.
Okay, all right, so we'll go ahead and do a roll call vote. Those in favor of approving the nicotine-free generation regulation as written, start with Dottie.
I approve it as written.
Okay. Randy Kring, I approve it as written. We'll go ahead with Jim.
Sure, Jim Whalen, I approve as written.
Kurt.
Aye, I'm in favor.
Okay, and Portia.
I approve as written.
Okay, so that concludes the vote. Thank you very much. So the updated the nicotine-free generation regulation has passed with the unanimous vote from the Concord Board of Health. Thank you, everyone, and thank you for all the attendees as well. Thank you.
Yes.
So that concludes that portion of the meeting. We'll move on to the next portion of the meeting, which is the body art regulation
Yep.
updates.
Yep.
Sure your
band's gonna work?
So we're moving on to the body art. Thank you.
work.
So we're going to talk about the body art regulation we updated in
What do you
June
think
of
about it?
2023. We had good success with we have now 2 body art establishments. What we did discover, we had an error where we inadvertently contradicted the state reg and said you might be able to tattoo if you're under 18. We need to fix that. That is not allowed by state law. So that's an update. It's on page 18, section E. Actually, wrong page number.
Page 6.
Page 6, 5C and D. That's just the simple change. And the other change is to the fee schedule. We did not outline a fee schedule. So we specifically set the fees to be managed by the town manager's office and also the fines to be as outlined on section 18. Any questions of that? That's all. It's not very lengthy. It's just, anytime we update our reg, we have to have a hearing and make it public. And be, opportunity. I informed our tobacco retailer, our body art establishment. He's the one that brought it to my attention that it was wrong. So he was like, yep, that's good that and he's interested down the line for us to change. If he has a temporary or a short-term audit body art, like a visiting, he wants to be able to address the fee to be partial. So I said, well, if we make it so we can set it to be less with the town manager approval, then we can do that.
All right, well, thank you for that overview. We'll now proceed to the public comment period for this updated regulation. I do not see any members of the public present. Is there anyone on Zoom?
A Zoom user?
If anyone on Zoom wishes to comment on the updated body art regulation, I would invite that to happen now. All right, and hearing no public comment on the body art regulation, I would entertain a motion to approve the updated body art regulation as written.
I move to approve the updated regulation
Thank you.
as written.
And do I have a second?
I second it.
Okay, thank you. So we'll go ahead and do a roll call vote, starting with Dottie.
I approve.
Okay, Randy Kring, I approve. Jim?
Jim Whalen, I approve.
Kurt?
Kurt Herman, I approve as well.
And Portia?
Portia Cadian, approve.
Excellent. So the updated regulation passes with unanimous support from the Board of Health. Wonderful. All right, and that completes our regulation update section of the meeting. We'll go ahead on to chair and board member reports. As chair, I don't have anything additional to add. Just thankful for everyone here who reviewed all the meeting materials coming into the meeting and being present. So thank you. Any board member reports from anyone present?
I actually do have one question. And Melanie, I don't know if now is the appropriate opportunity, but I told folks that
Oh,
one second, sorry, my daughter's Lenny, can you go in the other room, honey? So it's come to my attention that there are some pretty stringent regulations in Concord as it relates to food served in preschools. And it's only become clear to me as a parent of a preschool. And so basically what's happened is, I guess, in 2016, the Concord Board of Health notified a lot of the local preschools that they needed to have a commercial license in order to prepare foods for kids, which means, like, I guess, a commercial kitchen. So in 2016, there was a mandate to a lot of the different preschools that if they didn't have a commercial kitchen, they couldn't like cut up prepared foods. They needed to serve individually packaged foods. So what this has resulted in is, like, all these preschools serve prepackaged, individually portioned foods, which has resulted in like kids eating much more highly processed foods in schools at snack time. In any event, I've become increasingly aware of this, and so I've been working with Simon Cataldo on it as well. There are also overlaying mass regulations that basically are saying now that preschools can't serve a lot of these like whole foods, like fruits and vegetables, anything that has skin on them. In any event, the cost has become prohibitive. It's forcing these preschools to serve like highly processed foods. And when I became aware of it, I said, well, I'm on the Board of Health, so I can go look into it. They forwarded me some of the correspondence that they had with the Concord Board of Health back in 2016. So I don't know if folks are open to discussing this at some point, but between like the cost of inflation and, like, candidly, the more I learn about highly processed foods, like, I'm not thrilled that like little kids are eating highly processed food by virtue of like the regulations. So I don't know if it's a question for Melanie, the board, to think about. Obviously, like, we're the governing body who's like deciding what is safe for kids, so we should think about it. But I don't know if we have space on the agenda to talk this through, but it is definitely a big issue for the preschools in the town.
So appreciate your bringing that up. I would suggest that we maybe add that as an agenda item to a future meeting. And could maybe get some background from Melanie in regards to that. And if there is a specific recommend or thought that you would have on how to proceed, or change that you would like to bring before the board, then maybe we could add that as an agenda item going forward. Just from what you just mentioned, without any background knowledge on the topic to my end, I would imagine that this is in regards to the need for food safety, and so sort of an outcome of that. So I'm curious as to if a discussion of that would be beneficial to that extent, because food safety is the law. And so I don't kind of straightforwardly, or that's not a word. I don't see a clear kind of way around that barrier for that reason. I understand the frustration with it, but I think worthwhile kind of discussing maybe with more data in a future meeting.
Yeah, I think it would be helpful. I don't know if we could get the genesis behind the concerns. I can give more context. And candidly, if possible, I'd like to know what our town regs are on it.
So we're actually, can I just?
Yeah, go ahead.
So we're talking about the 2013 food code.
Okay.
And it's 105 CMR 590, it's state code. We don't have a local food code. We utilize the state sanitary code.
Okay.
And the state sanitary code talks about the minimum standards for preparing of food. And I don't know exactly what this individual preschools, I can't, without information and the context that what you're talking about. I know that there's some places in town I've worked quite a bit with, they don't have a way to wash, rinse and sanitize in compliance with the code. So they don't have a 3-bay sink, so they can't, but without looking at the context of what was banned and what they were told, it's kind of like me in 2013, the state adopted the 2013 code. This town may have adopted it at that time in.
In 2016.
In 2016, I don't know,
Got
I
it.
can't, just before my time. So when they adopted the 2013 code, with that came the requirements to have appropriate facilities to prevent, foodborne illness in children. And preschoolers are a highly susceptible population. So they have higher risk of being susceptible to foodborne illness, like a cut up melon sounds like, oh, I want to be able to cut up a fresh fruit and vegetable, but the actual melon needs to be washed and cut up properly, or else it can contribute to foodborne illness, and that's been documented. So I feel like it's important for you to communicate with me, B, to understand the background for why this regulation, and I'm only guessing at this point. But I do think that we don't have a local code, and in our just understand the Board of Health can be more strict than the state. We can do two things. We can be more strict, we can make a variance. But I do not think I would be supporting a variance for not allowing people to sanitize, wash, rinse, and sanitize. If that's why they can't have a food. Why they can't have a food permit. I don't know the details, and every place is a little different. So I don't know why those preschools, a lot of places, they just had like a kitchen like you have in your house. And they, I don't know, maybe if they said, this is what we want to prepare, they'd have to come and we'd have to talk about what they want to prepare, how they're going to be in compliance with food safety practices. So it's not,
go ahead.
So so yes, I'm open to discuss it, but it's a little bit like, you still have to be in compliance. I'm not gonna say you don't have to comply with the food code because we want to serve fresh fruits and vegetables. Like, it's more like, well, what are the practices? What are the facilities? We'd have to take a look at that.
Yeah, I'm happy to give further context, and maybe it sounds like, Melanie, what I can do is I can provide an email. I'm, candidly, like, a number of parents have come to me asking about this.
So what I would suggest, Portia, is that you advise them that this is likely state food code. And that if the preschool wishes to change how they are preparing and providing food to their students, that they reach out to the Board of Health and the Health Department for guidance.
Our health department or the state health department?
No, to me. So
to you, Melanie. Okay. Yep.
If they would like to change and have a food permit, the process is to reach out and say, this is what we'd like to do. And it's going to start with what their menu is, and their menu defines what they have to have for facilities. And I'll be happy to talk with you more offline about what the facilities require versus what people think they want to do. Because they have to serve food to the public, which is what a preschool is. They have to have certain specific requirements based on what their menu is. So it's really kind of like you're talking in a circle, like, I don't know what they want to serve. What do they need to have for equipment and facilities?
Great. So just in favor of kind of moving the meeting along, thank you for that discussion. And we'll just ask if there's any other board member reports. Otherwise, we'll go on to the public health nursing report.
I just had a real quick question about that topic, Melanie. Does that Food Safety Act apply to food that parents send in with their kids? My kids are well beyond preschool, but I'm just curious.
No, I don't know.
Well, Kurt, it does. It does, because that's how this all started.
Well, I guess I'm gonna have to learn about that a little bit, because I need to understand what.
Melanie, why don't you and I talk offline? And I can give you more context, because there was an audit by the state, and then this, whatever. Anyway, point of the matter.
You're talking about
larger
two different. So preschools are overseen by two different groups, right? There's just, my portion is actually pretty small in the health department, Board of Health is the food code. The rest of it is, DESE. Like that, the requirement could have come outside of the Board of Health, could have become what so I don't know. I think we need to talk about it and to learn a little bit more.
Yeah, I'm happy to, Kurt, if you're interested, I'm happy to give people context. I'm working with Simon Cataldo on the state piece, there apparently is a town overlay, so I will provide the regulatory framework guidelines that I've been told are impacting the ability of like parents and kids, on food choices and how that, whatever, what our small role is in that web.
Yeah, and Melanie,
Sounds
I'm
good.
wondering too, it seems like a lot of people are with fresh fruits and that type of thing. I think there is like most recalls, like or concerns with items like that. You could probably add some information to this, but isn't it usually like strawberries and things like that that tend to be contaminated at facilities? Is it usually like produce more than it is anything else?
I don't. The different foods have implicated, and that means they're considered TCS, so time temperature controlled for food safety. So if a food is TCS, it's most generally been implicated in some sort of foodborne illness. So there are examples of a lot of fruits and vegetables that seem benign that have been implicated based on the contamination of irrigation water, handling and processing through the systems. So I think that's why they need to be kept refrigerated to prevent any kind of bacterial growth. But there's some things that are not TCS, like cucumbers. Don't ask me why. Really? So but I don't know, I'm not familiar with the rest of the reg that you're referring to, because that's outside of our Board of Health here purview, mostly with the 2013 590, the state reg, and the 2013 federal code. So I'm not familiar with the DESI state regulations. So I just need to understand a little bit what you're referring to.
Happy to give more background to the extent I can gather it, but also just put people in touch with like the folks that are impacted.
Sounds good. Well, why don't we move on to the public health nursing report? Go ahead, Moira.
So in September, there was one case of group A strep bacteria that's commonly found in the throat and on the skin of healthy people. Occasionally can cause sore throat or skin infection, much less commonly can cause severe or invasive disease like bacteremia, sepsis. And this was a case of bacteremia. There were 7 cases of Lyme disease, 42 for coronavirus, COVID-19, and 4 for tuberculosis. All of the tuberculosis were latent tuberculosis infection, not tuberculosis disease, and none of these cases were assigned to me for further investigation or connection with care, and they were connected to care in some capacity. Just as a reminder, the TB disease that local public health nurses help with, the cases are TB disease, priority contacts of TB disease, children with latent tuberculosis or positive tests, and class B latent tuberculosis infection. Any questions on the numbers?
The 4 tuberculosis cases are, and looking at July and August, 3 and 4, those are new, newly identified latent cases. I'm just curious. Sure.
Correct. And any other questions? And I can dive into community outreach.
Go ahead.
So just a quick update on the community health needs assessment. We had considered closing it just at this time. The current intern is working on code for the data analysis. And so while she does that, we are still keeping it open. There are a few more responses. For example, there were a handful more responses even today. So we're keeping it open a little longer. There are just about 500 total responses from residents in the town of Concord. COVID-19 tests, we've been ordering them through the Department of Public Health as we are allowed to and able to order free tests. And so those get distributed and made available to residents through the Council on Aging, through both library locations and through the health division. We did participate in offering hidden in plain sight substance use prevention education at the high school and both middle schools at back to school nights for parents in September. I gave a self-advocacy talk on self-advocacy in healthcare at the Council on Aging in September. And we are participating in Emerson's Community Benefits Mental Health Working Group as part of their implementation plan and the mental health priorities in their plan. I help to represent Concord in that group, as well as one of the employees of the COA. And so recently we've talked about the strategic implementation plan and have worked to try to get Concord to participate in the Yellow Tulip project, which is moving forward. Melanie, did you talk about that at the last meeting?
No,
Okay,
I don't think I have yet.
so the
It was
Yellow,
on the list for today, but go for it.
great. So the Yellow Tulip project is essentially something that Emerson has sponsored. So they are taking on the cost, and then towns who were willing to participate are. So Concord is one of those who's planning to participate, and essentially we get yellow tulip bulbs very soon, and they get planted. We're working on planting in front of the Beatty Center, and essentially we plant them before the frost, and they come up in spring, the beautiful yellow vibrant blooms that catch people's attention, and they'll have a yard sign in front of them, basically in an effort to increase awareness around mental health and decrease the stigma around mental health. Having a QR code likely for mental health resources on the sign. Basically that when everyone comes together in mental health and supporting mental health, hope blooms is the message there. I participated in a Stop the Bleed training through the Central Middlesex Medical Reserve Corps in September. And just a quick update on the October vaccine clinics. We had a successful clinic for employees last week on Wednesday. Vaccinated quite a few employees, both with the influenza vaccine and the updated COVID-19 vaccine. And this Thursday on the 17th, 10 to noon, there is another clinic for those 60 plus in the community at the Council on Aging, as that was promoted again today. It's been promoted for the past several weeks, but it was promoted again today on the town Facebook page. And then we have another clinic booked for influenza and COVID-19 vaccines to be able to offer those vaccines to the residents of the emergency assistance shelter. So that will be happening later this month as well. And that is it.
Great. Thank you very much, Mara. All right, we go on to the Public Health Director report.
Excellent, thank you. I have a hodgepodge of updates, okay? The first is the state did officially release our region from high for risk for triple E to moderate a couple of weeks ago. About a week after our board meeting, we had voted to do that. You guys had voted to do that. I met with state officials and some couple surrounding towns. And they said, hey, in lieu of our outreach and understanding of the disease and the risk, we're going to change our policy that we, keep high risk until frost and revisit that and lower us to moderate. And I'm like, excellent, we already did that, the Board of Health. But that is in light of the science and looking at the data, and it's part of the new initiatives to the state to be, using the data and citing the science to why they do things. I've been working with the police and fire first responders in both Concord and Lincoln to train on the clutter image rating scale. That is a nationally recognized way of talking and quantifying what you see for clutter in a home. So when a first responder goes into a home and they could write up, and that's to do with possible hoarding diagnosis or unsafe for human habitation housing code. That's in compliance with the state sanitary code. So we are trying to just do basic blind training for everyone with proper terminology and talk about different what you could see and what our policies are. In Concord, we have something called the Concord at-risk group. That is a meeting of folks, town staff that deal and respond to this type. So Board of Health, agent, the police, fire, social services, council on aging. So we try to address people that have a number of high volume of calls and the best way to help and support those folks in need. We continued through with food inspections. Dominique is training. We've had a good level of septic the last month. It seems to be pretty busy. On 9/30, on September 30th, I had a food business meeting. That was a forum of all the food businesses in town. We had excellent turnout. I was very happy. We did discuss a number of things about the 250th. The most important thing is I brought up the concept of a score or grading system to that group of people. It received pretty poor, a non-favorable response.
Sure.
I got pretty much beat up about like why we wouldn't have it. Because I was discussing piloting that with this group. For sure, they just a strong desire not to have a label in the window. I had a lot of feedback about the detriments of that. Trying to establish a working relationship with all the food businesses about what the needs are, about processes, about ways for a variance where that could be before a hearing before the board. So at this time, we're going to look at just kind of doing a score, but not making it public, not giving a grade. So, but people to understand the differences between the priority violations, the priority foundation and the core, which the core are the old floors, walls and ceiling violations. So they're directly corresponding to the risk for foodborne illness. So I think we're tentatively looking forward to moving forward with that, but not a placard in the window and not in probably and actually piloting it, and getting some data, and then getting feedback, and then talking to the board about a policy, if that's gonna be in favored or not in favored.
Sure.
I'm just trying to look at addressing the food inspections and the food safety system that we have. So, and that's really founded in strong training. So one of the key factors is having standardized inspectors and making sure we're all trained, and that's what we have to start on first with onboarding and training of everybody. So that's the goal with the food. I think most of you might have heard Megan Zamuto has been the deputy town manager and the DPLM director, and they're moving forward.
DPLM is
Division of Planning and Land Management. So the health division is in this building, it's the Division of Planning and Land Management. And Marsha Rasmussen was the director until her retirement 2 years ago, or a year and a half ago now. And they've made the decision to go back to that model and have a director of this division.
And there's a search underway for who that
I
would be.
believe it's not quite, there hasn't been a job description posted, but it is coming that there will be, a director back in this position. It's just a different structure.
So someone kind of directly above the
person
division
I will report to directly, and that person will report to the town manager.
Got it.
As far as, is there any other questions? I guess I wanted to open up to the board about other health activities or other things that are going on in town. If anybody had any questions about what we might be doing?
I think so. Great. Excellent. Well, thank you. That's a lot. Yes.
Well,
In between the updated regulations and
yeah,
Triple E and all of that.
we're
it's
not
certainly
bored.
Very
We're not
busy.
bored.
So
We're
yeah,
not bored here.
that's excellent.
Thank you.
Wonderful. So before we kind of conclude with.
Oh, I
the
forgot
comment,
my,
yes,
my calendars.
The calendars, yes. So,
Thank you.
since we have all board members present, good opportunity to go through. We, of course, have been meeting on, the
Third
third
Tuesday.
Tuesday for a long time, but, with the current board members, some conflicts of timing and trying to make it as convenient as possible for everyone to attend, had looked at updating the calendar to, either the third Wednesday or the second Monday. Just for me personally, I definitely prefer the third Wednesday. That I have a number of conflicts with the second Monday. In addition to it being, I think running into a number of holidays at times.
Why do we have a Sunday on here? Do you know?
Yeah, I was wondering about
That
that.
must be a typo.
Yes, okay, yep.
It was originally the 12th, which is a Tuesday.
Got it.
But then it looks like it was edited to be the 10th.
We're talking about August 2025. Yep.
I don't know how
Maybe
that.
a typo that may have
I
originally
think
been
it-
the 10th.
And the 20th, I
Wasn't
think
the
the 20th is the third Wednesday, so maybe it was supposed to be the 20th.
Perhaps.
Yes,
Yeah, I think that's
I think that's probably what it was.
Well,
Yeah.
it's not a Sunday.
Yep.
Okay, all right.
And then for November of 2025, so obviously a long time from now, but okay, it would be the I was curious why it was listed as the second Wednesday instead of the third Wednesday. The third Wednesday is the 19th. That's not Thanksgiving week.
It isn't. Thanksgiving is the
Following
following.
week, yeah.
Okay.
So,
So what happened
yeah,
is.
or is it the room availability?
Yes,
Okay,
so there's a number of different factors. When we change from Tuesday to Wednesday, we're competing with different users
yeah.
of this
okay.
space. And there's, NRC is already here on Wednesdays, and the Historic Commission meets every 3 weeks. So it rotates around that we're in conflict. And since we're the new user to this date, we get bumped.
Bumps, right, that makes sense.
So when, on the Wednesday calendar, when we get moved from a Wednesday, the third Wednesday to a different time, it's either a holiday or could be the room. So that's why there's, and I asked, Ariana to put it in different color to try to not make it more confusing,
Yep.
but to make it notice that that's not the
Not the-
regular schedule.
Yep.
Because it wasn't as simple as pick the third Wednesday and go with it.
Right,
as
no,
I
that
would
makes sense.
hope, Okay.
Yep, yep.
And the other one, on Mondays, we were trying to avoid the second Monday because we were avoiding select board meetings.
Mm-hmm.
So we do, at times, we have a select board liaison and we're trying to avoid that conflict. Should
Yep.
I have to present at a select board meeting, which happens a couple of times so far?
And sorry, those are on Mondays, you said?
There's on the first and third Mondays
Mondays, got it.
traditionally.
Okay, gotcha.
And then there's also room conflicts, holidays on Mondays. So
Yeah.
that
That's
one-
part of my
that kind
inclination
of-
for doing Wednesdays is just, it seems like it's more kind of firmly seated in the week and,
And give
Yeah.
us some time to review
Review,
documents
yes,
too,
exactly.
instead of,
over the weekend, yes, yeah.
it gives
yeah,
us
no,
just that couple
again, I'm-
extra days and for you to prepare documents and to get them out.
Right, I think I would still, the week before, target to hit it, be ready
Yeah.
by what Friday, so then you have the weekend plus a few days.
Right, that'd be nice.
Yes, indeed.
Right,
Yep.
we still try to hit the weekend, but,
Yep.
that is a goal.
Yeah,
Yeah.
just in case something,
For sure, yeah, to the point of this meeting, again, grateful that everyone was so prepared, but it was definitely a challenge with the holiday weekend and then coming right into the meeting today, so.
Correct.
Yes, yeah,
And I
so I
had
can
a-
see that Mondays being similar,
Oh,
just generally, yeah.
Mondays are tricky because we have then to back up our posting, we have to back up into if the
Because it has
number
to
of
be
changes, it's
Far
not,
enough in advance.
it's not Friday, it's Thursday by end of day,
Yep.
so we have to remember to do.
Yeah. So to that end, board members, what are your thoughts? I'm in favor of the third Wednesday with the, and just kind of being explicit with the exception. So my December calendar's already made, so I would need the December meeting to be on that Tuesday, instead of the Wednesday. So that's the one exception. And then for the February exception, it would be the second Wednesday instead of the third because of school vacation week. But otherwise, and then, no, and then we would, then it would actually be, oh, sorry, you said November 12th instead of 19th because of a room conflict.
Meeting. Yeah,
Right,
that,
okay.
those are, I put the calendar forward to our other members of this building, and
Yeah,
that's what I
that's what-
got.
Yep.
That's what I
That
got.
works.
That's what, the reasons why those days, and we'll cross-check everything before we make it final.
Yeah.
But that would make our November meeting on November 20th, so that is a change. That's a Wednesday.
November.
We'd already.
Oh, yes,
Our,
right.
our next meeting.
Yep.
And I
Great.
wanna confirm, because we're trying to hit and not continue to split Kurt. And make him choose.
With the 229 Main Street. Yeah.
And then, but I mean, I have no idea about other people's.
And just to be explicit, you know, of course, if there are dates where we have people who can't attend, if things come up, then we can obviously try to modify as we can, but just having a calendar, of course, is helpful for planning purposes. So,
Yeah.
so what do people think about the third Wednesday? Is that work,
Yep.
Dottie? Yep.
It definitely does. Monday, you're right, with holidays, you're never quite sure, is it, you know, so it'll be nice to have it in the middle of the week.
Wonderful.
I'd like to do Wednesdays. That would work for me. Yeah, Wednesdays would be great. Unfortunately, this November 20th, is a conflict for me. I'm not gonna be able to attend that meeting.
Sure, no problem.
Forward Wednesdays are great.
Yep. Kurt, what do you think?
Yeah, I would prefer Wednesdays to Mondays, just in general, for all the reasons we discussed. It's not a specific conflict, it's just easier to get ready for a Wednesday night meeting than a Monday.
Agreed. Yep. And Portia?
Hi,
She
all.
said,
I have
"Oh."
a crying toddler in the background,
Oh.
but agreed on
Gotcha.
agreed on Wednesday. I'm gonna jump off, but
Sure, no problem. Yep,
the
great. Thank
the
you for-
Wednesdays is great.
Awesome. Sounds great. Thank you so
Thanks,
much.
guys.
Great.
Bye.
Alrighty, so we'll go ahead and we'll double check and maybe we can send out to everyone once you've confirmed, but so with the only modification being not meeting on Sunday in August, but yes, but the 20th instead. Okay.
The third Wednesday.
Yes, wonderful. Okay, great.
Yep.
So finally, last topic on the meeting is period for public comment. Just one more time, I'll open up the conversation to any members of the public present. And confirming none.
I only have one other person on the public here, and they're not commenting.
Okay, excellent. So hearing no public comment, I will entertain a motion to adjourn the meeting.
I move to adjourn.
Excellent. Do I have a second?
I second it.
Okay, excellent. All in favor? Aye. Great.
Aye.
Okay, excellent. Well, thank you all so much. Really great work today. Really appreciate you all being here and for all of your thoughtful considerations. You all have a
Take
good
care.
night. Thank
Bye-bye.
you so much.
All right,
Bye.
thank you all. Good night.